Welcome back to episode 3 of Code Brew. I'm Joe King and this is Lukewarm.
Hey, everybody.
And we are excited to be back. We've got a great episode planned for you today that we've been talking about and, just trying to wrap up our previous conversation, some things that nursing school didn't teach you, but we also are going to talk about some things that they did teach you in nursing school. And then at the end, we do have something a little more festive for Christmas, since that's coming up in just a few more days. So,
gosh, is it really a few more days?
Yeah, a few more days. What's today? Today's the 17th. It's Tuesday the 17th. We're recording, so we've got 8 days until you get your stocking full of coal.
Oh, you will laugh.
I did get a gift yesterday. From my special person, and it says Naughty List Survivor. It's a coffee mug. For me, it's a hot chocolate mug. Naughty List Survivor. So I guess she thinks that I'm on the naughty list. I don't know if that's a good thing or bad thing. Anyway, moving on. So yeah, last episode, we talked about a few of our first experiences in nursing, and then we talked about some challenges. And today we've got a few things we want to dive a little deeper into, some of the lessons that nursing school did not prepare you for, and then, of course, a few things that they did. And then we've got a few funny stories to go over. Anyway, so stay caffeinated, stay curious, and let's spill the tea on nursing. Just one more thing, of course, as always, our disclaimer. The views and opinions expressed on Code Brew are solely our own and do not represent the views of our employers, professional organizations, or any personal or professional affiliates. This podcast is for educational and entertainment purposes only and should not be considered medical advice. Did you get that?
Got it. Looks like you did break your phone.
I did break my phone. Yeah, yesterday I was on a run. No, Sunday night I was on a run. I was doing great and my music wasn't playing. I pulled my phone out of my pocket and it dropped to the ground, and then in my scramble to get it, I even stepped on it, and now the screen is in need of some repair. I think it's just a screen protector though, but can you see all the cracks?
Kind of
terrible. Oh no. Well, that's been replaced though. I have a shiny new windshield with no cracks. So anyway, so the lessons that they did not teach you, we wanted to go over a few things. So we wanted to kind of start with time management.
I think we talked some about time management with, like plotting out your list. Like, I'm going to do this today, 10, 12. But we know that always gets interrupted.
Right.
I have a idea of what I want to do, and at least I have my check boxes. I put like a check box next to every single thing. This is a kind of a fixed time task. This is like a variable task. Like it just has to happen sometime during my shift. But how do you, bedside shift rounding, kind of really helps me with time management or like some capacity of it. I don't know. We've talked about this before.
Bedside round. Yes, we've talked about bedside shift report.
Bedside shift report. That's what I mean.
Yeah.
So like, I know like when I'm able to like see all of my patients at the beginning of the shift and get report, and I get like stuck in a room in the first like hour or so of the shift, I'm like, okay, I saw room 1, 2, 3, 4. Like it's okay that I got stuck in room 5.
Right.
I feel like that kind of helps me, but also like seeing like when I'm looking in the rooms, like, oh, okay, like I need this, I need such tubing, or like it looks like they're gonna need this medicine, or
that's an important point.
Talking about like
you
want your sleep medicine, but
you're assessing the patient, but you're also kind of assessing the environment that they're in. You're checking to make sure there's not something there that they're not supposed to have. Like, what if they became NPO last night and they still got
remove the picture?
Yes.
Get the picture out of there. You should be discussing that stuff. Hey, you're NPO, and that's how we're gonna get this out of your room, and yeah.
But I do think that's an important point, is you're not, whenever you're in there and you're doing that report, you're starting your day,
it's always an assessment. So it's not just talking to the patient.
It's not just talking to the patient. You're assessing the patient. You're assessing the whole room. You're checking.
Environment. Do I need to bring your pain medicine?
Being full or something like that.
Do I need to bring your pain medicine?
Yeah.
Are you comfortable?
Right.
Can we toilet you? All of those things kind of set yourself up for success. So not every single time you're going into a room and it's like, gotta go get that pain medicine. Oh, gotta go get that nausea medicine.
I'll be right back. Is there anything else I can do while I'm here?
So honestly, those boards are kind of helpful. Like,
Oh, yeah.
where you're actually saying, like I know this is a struggle within nursing, but like at least knowing when someone, obviously it's got to be comfortable for the patient to know too, like when their next pain medicine's due. Oh, it's due around their 10 o'clock meds.
Right.
This is the patient that I'm going to see close to 10 o'clock and give their meds so I can give their pain medicine too. I'm not going to see them at the 9 o'clock when I'm starting to pass 10 o'clock meds, because then I'm going to have to go back in there at 10 and give pain medicine.
Right.
So
I will say, somebody made a great point this past week, made a comment about the way you talk as a critical care nurse and somebody who floats on the floor, and how we think as ER nurses. Like, our day is not scripted, right? At all. There's no way to plan.
It's chaos.
It is chaos. I know you wouldn't be able to handle that. That's not your cup of tea, but it is mine. And it's an environment that I have thrived in and love. And, our day, like we would start our day, if we have patients in the morning, I mean, sometimes you even don't have patients in the morning, because it is typically starting from like 3 a.m. to 7 a.m. is a little bit of a slower time. And depending on where you work, I mean, some ERs, there's no such thing as a slow time. Okay, it just kind of depends on your environment. But you want to start your shift checking your rooms in a different way. So you do want to go check on your patients. You do want to do bedside shift report and kind of get an idea of what needs to be done. But
because you have no idea what's going into anywhere.
Right. So like the stocking piece, I mean, if you do have, and I've worked with some amazing PCAs, let me be honest, and we call them ER techs, right? But I mean, if you don't have somebody who's good, who's checking those rooms, like, you're going to have to go in there and make sure you've got flushes, you've got angiocasts, you've got, suction set up, because, as soon as you don't have it, you'll need to RSI somebody really quick and not have anything. So
yeah, I guess I didn't think about that, because like I kind of know what's coming up, and I've maybe got 30 minutes, an hour, 2 hours, whatever, before the patient gets there, depending on where they're coming from, if they're like
patient
in-house or outside.
You don't know.
I'm like, I need a bed alarm, when you're like, they're like, put this person in the room down the ED.
Yeah.
And
They put it there, and I got to figure out what I'm going to do next. So, but it is really important to me to have, everything that I need within reach. So I'm not having to go step and fetch. I mean, you can't do that with everything you need. Like, if it's not a trauma room, but we're suddenly running a trauma out of it, and you need to test you.
Always have your ultrasound machine there.
I don't always have. I got,
You're
unpopular opinion, but I do not like starting IVs with ultrasounds. Like, I like to do it the old fashioned.
I think I went for like central lines.
Oh, I don't use it for central lines. I don't do that.
No, I'm just saying, like, you just don't just have everything there. Yeah.
Nobody has like, an ultrasound for every room. Jesus. But
gosh.
No, I guess maybe if it's some fancy hospital with a lot of money, but I've never worked at one like that. So yeah.
Good stewards of their resources.
No. Well, that would not be good. But no, I just think like that's a good way to start your day from the ED standpoint. Or if you're in an area that is it's more difficult to plan, it's more unpredictable. Make sure your supplies are where you are, because whenever you go for it, when you grab for it, you want it to be there.
So I think that's really important. So supply. So serving at the beginning of the shift, what does that need? Trying to plan, kind of group PRN medicines and scheduled medicines like together. Supplies, which you said. So like, I know that we get this thing where we've, like our workstations on wheels are wows. So we can't call them cows, right?
I like cows. Why can't we call them cows?
I don't know.
It's because someone thought we were calling them a cow.
I think they probably just told like every hospital that though. In the world, there's like one story of this.
Just to be clear, I've never called someone a cow.
So that's why they're so like overloaded with supplies. Because like I grab like a pocket full of flashes and a pocket full of alcohols.
Yeah.
The end caps, the 18 gauge, like pull up medicines. Obviously, you grab all of it at the beginning of your shift. I think that's like part of the nose on swabs now. I think so. That's part of being prepared. I guess you see people with their fanny packs. Have you seen the nurse fanny pack?
Yeah, so the nurse fanny pack is a thing right now. It's not a thing.
I'm not opposed.
Yeah, you would. That's that thing. I've never been a fanny pack person.
I've just got a backpack that I lug around with filled with stuff, I guess.
No, well, I mean, there's from a rapid response standpoint, it's not a terrible. I mean, I think I probably could have gone with a backpack. We don't do that currently, but I do feel like a backpack would be helpful.
I just bring it into work, actually.
Yeah, I just bring mine into work too, with like snacks, all snacks. So
what else?
so we were talking about how do you manage like interruptions? Okay, because I feel like that's a good one. You feel like you have to address everything as it comes at you, but you probably need to learn some boundaries, like, I mean, especially like how you talk with patient families and stuff, which needs to be obviously professional and respectful, but at the same time, like, how can you say, like, I'll get to that in a second, like, oh, hey, like, I'm titrating pressors for this person whose blood pressure is 70/30. I'm gonna have to get back with you on whatever it is they're asking.
Yeah, I mean, I think that's a really good question. I think, it comes with time, like your ability to, it's like a acquired communication skill. I think being clear and saying like, yeah, like that is really important. I do want to make sure that you understand it. So, I want to make sure that I have the time to be in there. I want to show you. I think I've said before, like whenever I'm with a patient, I try to make that the only thing that I'm doing. Like I want to be fully present. And, I don't know. I feel like generally I have a good response from families and patients.
Yeah,
I think they can tell that, I really do want to make sure that they know, and I want to spend an appropriate amount of time with them and get them the correct resources. Maybe it's not me. Maybe it's like maybe I need to get a provider, and it's going to take a little bit for them to get there, but they're going to see them when they round.
I think the thing is, when you're developing your skills and your prioritization and stuff, you got to remember, what you're doing is important. And sometimes people are going to come at you with things that are not important, and also like, I guess this is a good point to address, like, phones and like personal devices and outside stuff. I mean, sometimes, we all say, well, you need to leave your, step away from your home responsibilities whenever you come into work, but it's really not. That's impossible, right? I mean, nobody like forgets they have a family as soon as they walk in the door at the hospital, but at the same time, it is probably important to stay off personal devices in your work environment.
Well, and if that person's called out twice and their family member comes outside and they see you on your phone, what does it look like? Even if you're on one of the hospital phones, you're communicating to a provider. I mean,
right.
It doesn't. They don't know that system,
right?
And priority versus non-priority. Like, I mean, we can definitely say like addressing someone's blood pressure is more important than getting, maybe a family member water. But I think this also goes back to, so yes, there are priorities, but I think that, and that seems so frustrating, right? When you're super busy and you're just like, they just don't get it, or whatever. Right. We forget that, these people are having like a traumatic time, new diagnosis, new potential care for their family member. They're going to have to move back home and care for mom, care for dad. And what seems like, maybe an inconvenience, like, why don't they just go buy a bottle of water in the cafeteria?
That little kindness can go a long way with some people.
I don't know. It's something they feel like they can control. They're parts. I don't know, but I think going back to, I love the quote you said last week. What was it? We're the care model. What is it?
Oh, being nice is the bare minimum. Yeah, I mean, we do. We have like our charge as a profession is to care for people.
So, like, why does it frustrate?
It's a lot of forms.
So why would while it might seem like a minimal request, it's something that someone needs that is here in a hospital,
right,
visiting their loved one, and just you can think about how sad it is sometimes when you have like the family members that aren't visiting their loved. So, somebody with a support system, trying to get care, experiencing a new reality, maybe just not ultimately going at it as like, they're out to get me. They want a cup of water.
Well, but I think there's like something to be said for caregivers, right? And people who are taking care of a loved one. And that's a really difficult job. Like that's a lot of responsibility. I mean, obviously depending on the level of care that's needed, but
24 hours a day. I mean, I can't imagine.
Yeah. No, I mean, some of our patients do need 24/7 care, and that's why the family's there in the hospital. I mean, so, what we can do to help, just give them a little bit of kindness, a little bit of relief. And that's something to really think about. Be grateful that your patient has a support system and consider their needs. But moving on, we wanted to...
like delegation.
Delegation. Yeah.
So delegation can be really helpful for time management.
Yes.
Over delegation. So it's great. Like delegation is great, and knowing what you can delegate and what you can't delegate, and having a solid understanding of that. I know that it's really hit in school, and it's important throughout your career. Especially as we're looking at LPN models and hospitals, and we've expanded scopes. PCAs and advanced PCAs or ER techs that you were just talking about.
There's so many different...
So we can paramedics in the hospital. So what can all these people do? But then do I, you constantly hear about the nurse that takes off all of their isolation gear, and walks out of the room and walks around the floor twice to hunt down the tech or the PCA to tell them that the patient whose room that they were just in wearing isolation gear needs their urinal emptied. So at what, while you might be it's my 10 o'clock med pass or whatever, you're going to be dealing with I don't know, conflict from over delegating so much that you're not saving yourself time. Also, you literally just walked around the floor 2 times and knocked on the bathroom door and called down to the cafeteria. It's kind of when I see, I'll see people call a lab, a few times to collect a lab.
Right. And it's
when maybe you could collect it faster just by sticking your stuff.
I think that's a whole different thing for me. I always, in ED, you draw your own labs. I always drew my own labs.
Yeah, I always draw my own labs.
And I mean,
unless I don't see anything at all.
This is a pet peeve for me, and I realize from the ED, it's a little bit of a different perspective, but that is a nursing skill. If you are a nurse and you have not put some time in developing your skills as far as starting IVs and phlebotomy, I think that's important. If you lose an IV and you need it, give it a shot. There's going to be somebody that you can ask if you need more training and that kind of thing. Please reach out to someone.
Well, I think an opportunity for me. So what you're saying right there, to piggyback on, I will start IVs for people all the time. I need to do a better job about saying, I'm going to start the IV for you, but you're going to come in there with me.
Yeah.
And I'm going to show you, hey, let's find a blood vessel together. What would you choose? What is it? Teach one, grow one.
See one, teach one.
See one, do one, teach one. Yeah, whatever the saying is. But, I'm in my mindset, I forget. I'm busy. It becomes a task rather than I need to grow somebody.
Well, those of us who are, well versed in skills, it doesn't matter the skill.
Thank you.
I didn't say you're well versed. I was talking about me. I can stick something from across the room. No, don't test me on that. No, but those of us who are well versed in the skill, it doesn't matter the skill. If you get to the point where you feel confident in your abilities to perform a skill, whether that be Foley's or IVs or, I don't know, NIH. I just did one of those the other day, so it was on my mind. But, whatever the skill may be, take the opportunity to grow someone who doesn't have the skill. Yes, it may take a little bit of patience and stuff, and not all of us are great with patience as a virtue and not patience as a person. But But yeah, no, I think it's important to pass on these skills.
The skills that you really wanted to learn in nursing skill that
the ones that you want.
you literally like complain to your clinical. I never got to start an IV.
Yeah, how many nurses do we know that get on the floor and they're like, they don't know how to start an IV, and it's like, okay, well, let's learn right now. Give me the stuff, Anyway, so moving on. So one more thing as far as delegation, you had a good quote that you wrote down on our outline. Just because you can doesn't mean you should. So I think that's a good rule of thumb.
I don't know who that came from. Somebody told that to me last week, and I love it.
Yeah, but as far as delegation goes, just because there's someone who can do this task for you doesn't mean delegating it to them is always every single time the right thing. So consider what you have the time to do, because, the name of the game is teamwork. Healthcare is a team sport. So going on to communication skills, handling tough conversations. What is your thoughts on that? And we've talked about, providers and stuff.
Gosh, so with providers, be prepared. Like, I mean, I had to write it down. I don't know if we talked about this, but like, I would have to always have the vital signs.
Yeah.
Like, SBAR it out. Your hospitals actually have sheets, a lot of them that say like when calling a provider, but it's, tell me a little about the patient. Are you familiar with them in case it's a on-call service at night? What's going on? Current vital signs. But I would write those things out before night shift, calling people at 2 a.m. So
it might get grumpy.
You want to have that information for them. They're doing surgeries at 5 a.m., right? Like, well, to be respectful of their time, but also, we need to be prepared.
Right.
If we're calling somebody at 2 o'clock in the morning, we should have the information.
Give them a little grace too. I mean, I can tell you there's a couple of times that I've woken up physicians when I was on night shift. And I felt like they didn't really understand what I was saying. I had to repeat myself a few times, and I repeated the orders they gave me a few times just to make sure we were all on the same page, because these are human beings.
Anyways, always repeat that.
Well, always,
but a few extra times.
But yeah, I mean, if you're like, are you sure you want to do this? Make sure they're sure. Okay. So then the last thing we wanted to touch on a few topics. We've had a few topics that were recommended to us. The first one was a dear friend and colleague, Candace, was, very honest and Candace shared that she experienced burnout at one point. So she wanted to point out that, she didn't know the signs and symptoms of burnout really, so she, as a newer nurse, she didn't know how to recognize that in herself. And then she also wanted us to talk about resilience and how to build resilience. And that's a whole, we could probably do.
I feel like that's a whole episode.
Yeah, it is a whole episode. We would definitely want to talk about that deeper. But I will say, one of the things that we did talk about is setting limits. That's something you wanted to touch on.
Yeah, you're going to get a lot of calls. We want you to pick up.
Yeah.
Can you just come in for half a shift? You'd be great in this role. You'd be great in this committee. And while I think it's great to join committees and know what's going on and share governance and do professional development and get certified, I think all of those things are great. I think that
there is such a thing as too much.
Yeah, I think it's important to learn how to say no and feel comfortable in saying no.
Don't do these things like, by also sacrificing time with your kids or something, Yeah,
I mean, if it's not something that like you're like, oh my gosh, this is exciting, or what a great opportunity, or maybe I'll go to a meeting and see what it is and fill it out or whatever. Maybe now is not the time. I'm always gonna say shared governance is great. Certifications,
100%.
Being involved.
We do all those things.
And decision making. If you have the ability to own your practice, that's awesome that your facility lets you do that. If you're making decisions about how you as a bedside nurse take care of your patients. But I do think that sometimes when you're the person that always says yes, like I'll do this month and I'll run this and I'll run that, like it's easy to get kind of worn down.
It is.
Right?
It is.
I feel like there's probably other reasons why she said, the moral distress and,
Oh, yeah.
and burnout. I really do think that that's a whole episode. You're just, you're learning so much. Like when you first start nursing, it's a big shift from clinical kind of like watching, kind of having responsibility for a partial patient, but really like I'm concerned about paperwork, to, capstone, which is kind of serious, but like still someone's there,
right?
Your preceptor, someone's there. And then all of a sudden it's like, oh my gosh, they're like, let me go. Like this is me.
Yeah.
And
it's a lot of weight.
It is. It's
a very heavy. I mean,
and there's gonna be so many things you learn in that, like you're gonna miss things and you're assessed. Like, like there are gonna be things that you're
gonna make a mistake.
Learn from, mistakes.
Right.
Not on purpose.
Not 100%.
But the weight of that is large.
And you're gonna learn a lot about yourself through the experience as well. I mean, I'm not even close. Even my, like I remember a couple of years in to being a nurse, my mom pointed out like that I was so different since I started working in the ER. And, she was, having trouble putting it into words, but just like I don't know. It was almost like a loss of innocence or something, maybe. Yeah, I know. I was pretty young though, still. So, but no, I mean, you learn a lot about human beings, and then it changes you, and then you learn a lot about yourself. So that's a heavy process. The other topic that's been suggested to us was Hunter said, she got out into she'd been through BLS and stuff, but she got out on the floor and realized she didn't know how to do anything in a code. She didn't know what to do in a Code Blue. And Hunter, we definitely want to talk about that. I think we're going to do probably a whole episode probably on Code Blue as well. Because you're right. You probably don't know what to do, and it's a high-stress environment. Your brain goes blank. So we're going to unpack that at some point, too. But, I guess my only thing...
I think if you're the primary nurse, be there for questions.
Yes. Oh, yeah. Don't leave the room, please. Okay. And
start BLS.
We're coming. Okay. When you call the cavalry, like we're the people that are coming to be the cavalry in a lot of situations. So like we need to know about the patient. So
go-kart pads, presents.
Yes. Chest compressions. That's first. Chest compressions first, always. And push that blue button on the wall if you have one, because that is how we know you need us. Okay. So our next topic is what nursing school did teach you. So just a few things we want to talk about that we've kind of touched on before. But I think the best thing that new grads bring is that they have basically knowledge of like the most recent evidence-based practice. Like I remember whenever like I was like the last nursing students that learned to blow up the balloon at the end of the Foley to test it.
Oh my gosh. I was just thinking this in that. They just talked about this graduation the other day. Like it was in a speech. And they were like, do we talk about this? Literally the person giving the speech was like, a new grad actually is the one that taught me. So this is someone that's worked in a hospital for 30 years.
Yep.
He's like, literally a new grad like 2 weeks ago or something taught me that we no longer inflate the balloon in the Foley gap.
Right. So you don't know that unless a new grad tells you. Because, I mean, I haven't gotten any teaching like that. Not really.
We have a really good research council, right?
We do. We do. It just hasn't come up. But, I mean, it seems like that. They have the latest EBP, right? So.
Well, we're talking about, gosh, when I graduated, it was the air? You blew the air and the NG tube to
make the sound.
Yeah, then then it was like pH and the gas. So all the different things just to my lifetime.
Oh, yeah.
As a nurse.
Well, I was like comparing.
Gold standards.
I was comparing it. I texted her the other day, and I thought, we're like new grads are like the latest iPhones coming off the line with the latest software, and we're like the iPhone 5 that's been like updated so many times.
Durable.
Is that a good analogy? We're not Nokias. We're not that old.
I might be a Nokia.
I mean, I definitely had a Nokia, if that's what you're asking.
I'm a fan.
Yeah, I mean, those things were, old trusty. But no, I mean, we're like, some of our knowledge has probably been there a while. And then, our new grads come out, they're fresh, they do all the latest things, they know all that, they have all that fresh knowledge. And that can really,
energy.
Yeah. Oh, yeah. And new ideas, like fresh perspectives on things. Like, I mean, it's really for us, like, we get excited about new grads, right?
I mean, I think it's pretty exciting. Established goals.
Yeah.
Hey, you want to get certified?
Yeah. I mean, like,
hey, you get your ACLS?
I mean, I've looked back and I've thought about
like, I just want to get their orientation. I'm like, I know, but 6 months. What about 1 year?
Think about some of the people you precept. Okay, because like I have a girl that I precepted way back as a new grad nurse, and she's an ED manager now. Like I have a girl that I precepted who is a shift supervisor, like in an ED. Like there's I've seen, I have another girl that I precepted as a travel nurse now and is living her best life, and I mean she just looks so happy. Like I look back on these people that I precepted and watching them grow is so exciting too.
I think that is exciting. Like all of my students have become like doctors.
That doesn't sound pretentious at all. I make them all doctors.
But no, I'm like, huh, this is weird. Like I'll be taking orders from them, some, or whatever. Yeah. But or no, they just stayed working here because it's so awesome.
Yeah, I mean we do like the place that we work for sure. We get excited about our jobs. But I definitely just love to see growth with someone that I've helped be just a small part of their journey. I think that to me is really exciting.
I did have someone at graduation of the day say, you might be getting a letter soon. Okay, so this person, I would have no idea that they ever thought this.
Okay.
So this isn't like a pat on my back, but it does speak to like, I would never have any idea that this guy thought that I was so impactful. And I'm at graduation, one of my friends is graduating, and I'm gonna have students there, and he was like, I want to get a picture, and I just want you to know that you might be getting a letter. And then he like starts talking to me about that. We were supposed to write a letter to like our most impactful person like throughout our nursing school, but I didn't know, I mean, like he was always eager and nice and like a great kid and clinical student, but it just sometimes you just don't know. And they say that sometimes you never know the impact that you make on families, on patients,
right.
on people in general. So you hear it, but I think like weird when like you don't know, and then all of a sudden you do know, and I was like, well, that was really adorable.
Well, congratulations. That's great. That's awesome. Maybe he'll nominate you to be a Kentucky Colonel.
Okay. Someone's like Kentucky Colonel in this room.
Oh my God.
And it's not me.
Oh my God. Okay. But I think, so we had a quote that we had just for this, like our nursing school gives you the foundation, but the real world builds the house. And
I like it.
Yeah, I really like that too. And I think that's a good way to look into it. Like you're not going to be ready your first day on the floor, but we're going to work on it. We're going to help grow you. And I mean, we as this, this generation of experienced nurses that have come before you, and, we want to be there to support you. And, we're going to go into, also a conversation at some point about precepting. We promised J-Dog we would talk about precepting, and we're going to do that because we want to talk about also like how we can be better preceptors and give you what you need. So anyway, moving on. So our next topic is the hilarious. So you had some stories that you wanted to talk about.
I mean, I think this wasn't like the hilarious. This was like things that you'll learn. Like, I feel like everyone is going to turn an A-line the wrong way one time, and then they're going to always know which way the
transducer,
not the transducer, are valves.
Oh,
They're gonna open up the patient. Blood's gonna shoot out.
Yeah.
You know what I mean? Like so learning from those experiences.
Yeah.
I just was saying like you're gonna not clamp your G tube, and come back with tube feeds every.
Yeah, you'll learn that.
And then you'll probably never do it again, right? The Alon, it's gonna shoot blood one time, and never gonna do that again. It's just a weird learning experience. Like, oh, okay, I know which way it goes now.
Well, I think so. You're not going to come out of nursing school knowing how to set up an A-line, okay? So don't expect yourself to pull that out of the bag and know what to do the first time. Have someone teach you. I just recently went over that in the ED with some nurses, and they were like, "We don't do this very often." I was like, "Yeah, it's fine. Let's just go over it," because you don't want to figure out that it hasn't been done right whenever it's connected to the patient. We got to go through all these things. So, but yeah, no, A-line is a good one. I think so too. And then forgetting to clamp the G tube for sure. What about the Foley catheter mishap?
I mean,
tell them.
I'm just
saying.
They don't know. No, I'm just saying, when you're going to place up. Okay, so
a Foley catheter.
Maybe you're perfect. There have been situations that I've been in where I am placing a Foley catheter in a female, and it will all of a sudden the tip is coming back out of it.
Yeah. So you picked the wrong.
I'm thinking fistula.
I mean, that could be too. I mean, there's a lot of things that could happen. Not everybody is built the same. Let's be honest, okay?
So, and I think this goes back to the
because most people doesn't look the same.
Well, in school, anatomy is so perfect. So,
right. Well, it's plastic.
So or rubber, whatever it is. Yeah. But it's you're in there. There's not family. The patient's not gonna ask you questions. There's no awkward about that, except that maybe your cohort people are watching you. But when you're going to start the IV, it's you can see on
where the
arm,
last 50 people
the last 50 people are stuck, and the veins are amazing.
Right.
Gosh, I still look at veins in people's arms. I'm like, oh my god, they've got great veins. So you,
100%. I do that to you.
I have good veins.
Yeah, you do have pretty good veins.
Right now they're not that.
Well,
they're not. My veins are your threshold of good veins isn't my threshold of good veins.
You can put one right in your forehead.
But so anatomy is very standard in nursing school. So
right.
You've got,
but that's not
the male mannequin, whatever. It's very easy to get the catheter, and it's not weird. There's no.
Yeah, that mannequin has definitely had his prostate removed.
Yes, it's just fair.
It doesn't go in that easy. I don't know. I mean, that's when I had my problem. I had one time, I had a guy, a new grad. This was my new grads. I was precepting him. This was his first time watching me put in a Foley, and it was a male, and he had some issues with, some BPH or something. And it was a struggle. We had to be firm, and give some firm pressure. My little new nurse, he got a little queasy. He had to sit down.
My first clinical I passed out.
Did you? I love that.
My clinical instructor, let's see, I had already been in school for quite
12 years.
Some 10 years full time. 11 years full time. 11 years full time at this point. But so just starting clinicals, 3 degrees deep, and she was just starting an IV. My clinical instructor was just starting an IV. Blood didn't go anywhere. It was just the flash.
Straightforward.
All I saw, no, there was no squirt of blood or anything. I just saw the flash come up.
And you're just
in the angiocath, and I slid down the wall. I did not go to the next clinical. I was I'm not gonna do nursing. This is insane.
That's all it took for you.
And they told me. And then what did they tell me? They said I reached out to her. I was like, what am I to do to make up this next clinical later? Because I changed my mind. I was like, I can do it. And she was like, you have to clean the morgue. And I was like, I'm definitely not going back. There's no way.
Man, that's harsh. I need to. What's it? I should discuss this later. I need to be here.
Now I could be doing the weirdest thing, maybe, or something that you might consider weird or gross or whatever, and I'm like, is it nacho bar today? I'm just kind of completely different. You get used to it.
Oh yeah.
But gosh, I don't know.
There are things I'm not allowed to talk to me now.
Yeah. I spouse is really good at ignoring me, but I do know that other people's spouses are like, when is this conversation?
Oh, I know.
Yeah. Sit to know the other night.
And
we just kept being like, this is our last one. This is our last one.
oh yeah,
This is our last one. We won't do it again.
we have stories, but like we have these great stories, and these great stories, they come from moments where we probably panicked a little. So just you remember, like, when you have these moments when you're like, oh my gosh, what just happened? But you're normal. We've all been there, right? So the last thing I wanted us to talk about, so Christmas is here. It's upon us. Luke's face says he has not finished his Christmas shopping yet. And so, I just wanted to talk about like some things that really bring me a lot of festive joy around the holidays. Like, obviously having to work the holiday is not great, because you have to miss time with your family. But we try to make it fun here. So a few things that I remember. Well, first of all, a tradition that I started a couple years back, and I'm trying to keep it up now, is I'm wearing a Christmas suit every year. So coming up, I got a new one. Last year it was green with lights. It had like a tie and everything. I did have to learn. I had to Google how to tie a tie because I didn't know how.
Oh, that's fun.
Yeah. So this year it has a bow tie, and it's like bow ties for dummies. So no worries. I don't have to Google it. So I'll probably post a pic at some point. I'm wearing it this weekend, so I'm working this weekend, then I'm off for Christmas. So that's a fun thing for me. I love seeing everybody else get dressed up and festive, whether it's like a t-shirt or like those necklaces with the blinking lights.
Oh, I saw one say it was really cute.
Yeah, it's really cute. Or like, some people wear like the antlers or like, whatever headband or something. Those are fun. But you gotta remember too, like, people are in the hospital for Christmas. There are people who are patients here for Christmas. They don't get to go home to their families, and you might be bringing them a little bit of Christmas cheer. So I'm not saying you have to dress up or, do whatever, but, I think it is really nice to bring that to your patients. So I get excited. What about you? What's your favorite Christmas memory?
You dressing up.
Yeah. With my tie that I had to Google. Yeah. No, I'm excited.
I assumed it was like elastic in the back. It's a real tie?
Yeah, it's a real tie.
Wow, that's fancy.
No, it's a real tie. Yeah, I had to learn how to tie it. And then, Luke I've been trying to talk him into, to getting a suit for himself and joining me.
Oh, what? Last year's. Don't you have two?
Yeah, I do. It's an extra large. Is that what you wear? I don't know.
It is.
I'm in a medium now, bro. I mean, we did.
Congratulations.
Yeah, I know. Yeah, I'll rub it in. No, so another thing that I thought about, I worked in an ED when I was travel nursing, and they had Elf on the Shelf in their ED, and this elf was definitely not on the nice list. He was wild. He did some crazy stuff. It brought me a lot of joy, okay?
I kind of like it.
Oh, I love it.
Yeah.
It's amazing.
What a good, kind of like team building, funny thing to
So, they had, I think the night shift supervisor is the one who was like doing it that year, and she was like coming up with great ideas. And so like managers out there, or anybody really, like, hey, Elf on the Shelf at work, you can do some fun stuff. I will say some of it, make it wild, have fun with it, but that was something that I really enjoyed. So I answer the little things like this that really just keep the spirit alive while you're working, and because working in the hospital is heavy. It's hard to keep the holiday spirits. But yeah, I think there's ways to do it, right? What are you laughing about?
Sorry, someone just attacked by a squirrel. Sorry. I just picked up the phone and I'm like, I don't know. Yeah. So
I'm gonna put this on the podcast.
Yeah. Well, he was attacked by a squirrel.
Luke's husband was just attacked.
It got in through some AC thing.
This was a conversation that we had prior to the start.
I shouldn't have looked at my phone, but he was like, what does it say?
Oh man.
Squirrel jump on me. I was like, it's jumping on you. And he said, but that fell on the stairs from the window. It's.
Is it outside?
I don't know. There's so many messages. He wants to return something now.
So
I don't know what
World crisis averted. He's going back to online shopping.
He wants to return something to Costco, so I guess he's fun.
Okay.
A little dramatic.
Okay. Wow, this is fun. So anyway, so some things that I've seen along the way to make the holidays, fun. We love potlucks, right?
I had a potluck today.
Yeah, we
So
love
good.
potlucks. Okay. All the potlucks, nurses love to eat. So, if you haven't ever had a potluck with your department, or if you don't know what a potluck is, what do other people call it?
Dipsgiving is a new thing.
Dipsgiving? Only dips? I need cake.
I mean, dips are
sweet.
Dips are great. I think it's like an easy version for Friendsgiving, but I think we're doing it for Christmas too.
Dipsgiving. Okay.
Maybe that's not what it's called. It's giving dips. No, it's not. It's giving. That's like too.
Yeah. Dipsgiving.
Dipsgiving.
It is a millennial thing. We did. Yeah. So I love when people wear Santa hats, right? Oh, I love festive scrubs. Like if you can find, obviously within your facility policy, if you can wear scrubs that have
to make people happy. Sure.
I'm all about that. I wear a suit to make people happy.
Yeah, I'm gonna check to see if I can.
Let's see what else. So now I have to say this.
What do other people do?
Other people do.
Oh, tell us.
What do other people do? Oh yeah. What do you do? Yeah, sorry, I'm not tracking. What do other people do?
I feel like the children's hospital has this down. I feel like
okay, Pete's nurse.
PICU, NICU, Peds. I feel like they have these things
on the adult side to be festive. Okay, y'all are probably the experts. That's true. I haven't thought about that. So I wanted to say this because we're pretty fortunate. We work somewhere where the facility gives us a Christmas gift. Like our hospital gives us a Christmas gift.
Oh, but you want to know what other people's Christmas gifts are?
I just wanted to give a shout out. Even though people don't know where we work, we love our job, right? So, but we also there's a lot of cool perks to working here, and they did give us a Christmas gift. So, what?
I'm just wondering if we got the same gift.
I got the pullover.
Yep.
Yeah. Did you get the cup? People are really talking up the cup. Sometimes I kind of wish I'd gotten the cup because it has I got a
lot of cups. I need gear.
I needed stuff to wear for sure. That's why I went with the pullover, and it's awesome. So if your hospital, and this could be a sore subject for people who don't get gifts, but we just work at a place, we do feel pretty appreciated. We get gifts for Nurses Week too, and they're really kind enough to think about us and do this. So anyway, so the other thing as far as Christmas goes, to all of you who are actually having to work Christmas Day or Christmas Eve, New Year's Eve, New Year's Day, who's missing out on time with your family, your friends, or whatever your holiday traditions are, we see you. Thank you for, working hard on the holiday. Thank you for being there for your patients. And just know that you're appreciated, and for your patients, you're going to bring Christmas to them in a time when they're really sad. So, unhappy to be home at the very least, unhappy to not be at home.
Yeah, I was like, is that a double negative? What did that?
Yeah, I don't know. No, but yeah, you're a vital part of the hospital, and you're appreciated. And we just want to, we say we see you and we appreciate you. So, thank for you. Good.
Happy Christmas. Merry Christmas.
Merry Christmas.
Merry Christmas.
You don't even know what is wrong with you.
Really do Christmas when I was a kid. We did it.
You did.
Well, not like presents and stuff. I don't know. Happy Merry Christmas. You can say both.
Merry Christmas. I'm normal. But so anyway, wrapping up, we're at the end of our time, folks. So key takeaways from the episode. Just want to recap. Nursing school is the foundation, but the real learning happens on the job. Okay. We're going to build the house once you get on the floor. And then
you'll have time to do that.
Yes.
And resources.
There will be time. There will be resources. And, we want to encourage those of you who are experienced to be those resources. Look around, see who your new folks are, and commit to being a resource for them. Be a mentor. Be kind, And then every nurse has been in your shoes. And, we all should be here to help. We all should be remembering what it was like to be new. And, just a commitment. I would love a commitment from our experienced nurses to stop eating our young. It's been this tradition in nursing for a long time. And I say throw it out. Be kind. Not sure what our next episode's gonna be. We haven't decided 100% yet, so I'm not really sure.
Mysterious.
Oh, mysterious. Anyway, stay caffeinated, stay curious, and we'll see you next time on Code Brew. Bye-bye.
Bye.